Welcome back to Mayo Clinic Radio. I'm Dr. Tom Shives.
And I'm Tracy McCray.
Tracy, the high cost of medical care, everybody knows about it. Everybody's concerned about it. But even for those who have health insurance, it's keeping some people from going to the doctor.
High deductibles and uncertainty about how much it really costs are partly to blame.
A recent Bankrate Money Pulse survey found that a quarter, that's 25% of the 1,000 people that they surveyed, said that they skipped necessary medical care because of the cost.
Here to discuss how healthcare costs affect patient decisions is Dr. Ed Creagan. Welcome back to the program, Dr. Creagan. It's great to see you.
Thank you. It's a privilege and an honor to be in this pantheon.
All right, first question. Cost of medical care in the United States, it has become a huge issue.
This is a pandemic, Tom. One of our senior leaders of the Mayo Enterprise took the stage several years ago. This is an iconic healthcare administrator, and he made the comment that until we get sick, we have absolutely no concept of our health insurance. Until we get sick, we have no idea what the bottom line will cost us and our family.
And I think the estimates, even once you have retired and you're on Medicare, the estimates for how much it's going to cost you for medical care for the rest of your life, let alone being in a nursing home if you have to go there. I mean, it's astronomical. It's 5 times as much money as most people have saved just to retire.
Absolutely. And no one can give you a figure on what that will be. If a couple makes it to 65 without shooting each other, they have a 90% chance of making it to 90. So clearly most of us have not planned and don't embrace that the golden years may not be so golden.
So the fact that people are skipping necessary medical care because of the cost is not a surprise to you?
It is not a surprise. Let me give you an example. Several years ago, I met a gentleman from Wisconsin who owned a mom-and-pop radio television store, the kind you never see anymore. And he had a malignant melanoma on his left calf. It was thick, and there was the worry it could come back. I see him, and I asked him how things were going. He said, fine. On physical exam in his left groin, there was a baseball-sized nodule, the size of a fist. It was tender. It was red. He had a scratch on his leg, and his wife, who had a copy of Family Circle magazine, said, we better get a PET scan. His daughter, who was a nurse, said, no, Dad needs a pelvic CT. And there was a medical student from Harvard who was a member of the family, said, no, we need an ultrasound. And the patient said, you know, Doc, you're going to burn through my $10,000 deductible with one stroke of the pen. The only people that ever raise issues of cost are the independent business people who are not part of a group insurance. Otherwise, people are clueless about what this costs, and there's no free lunch.
Well, it's partly because insurance pays for it, and the doctor's got no skin in the game.
Absolutely. There is no commitment from us. But let me give you an example. 2 days ago, I saw a woman from another state who was 70, but she was dead fit, to use a racetrack term. She had advanced lung cancer, had standard therapy, and was not doing well. We shared with her our Mayo experience on a medicine called pembrolizumab, or Keytruda. This is the Jimmy Carter treatment.
And this is the one they advertise on TV, isn't it?
Yes,
yeah. Mm-hmm.
Advertise on TV.
Mm-hmm.
So we told the patient and the family, look, we've had experience using this medication. It's not FDA approved in your case, but realistically, the options are limited. So we offered her the treatment, and after 2 cycles, she had a dramatic response. She felt like $1 million. That was the good news. The bad news is that the insurance company refused to pay for the medication. The price tag on this medicine is $150,000 a year, $13,000 every 3 weeks. So we had to abandon the treatment and consider an alternative program because of the wallet biopsy.
Yeah, and somebody's got to pay for the TV advertising too.
Absolutely.
This is part of it.
My understanding is that there are something like $900 million spent on direct-to-consumer advertisements.
All right, so we've got a problem, obviously. And it's high deductibles, high cost of insurance. What do we do? Where do we go? I mean, are we destined for socialized medicine in this country?
If you look at the headlines today, that the current GOP proposal may not pass the Senate. So there's going to be a tremendous refinement of our own coverage. But I think each of us needs to challenge the healthcare community and say, okay, doc, I'm listening to you. What will this cost? Let me give you another example. A businessman from the Twin Cities was moving his wife's furniture. 2 days later, he could not get out of bed because of back pain. The wife, whom I know quite well, insisted on a fancy MRI of his spine, which of course they did in another part of the country. I won't mention it, but it was the land of the Gophers. And as expected, this showed extensive arthritis. The family practice physician said, okay, see an orthopedic surgeon, see a chiropractor, see a masseuse, see a physical therapist. $20,000 later, the patient's spine problem went away and he felt well. So we need to listen to our providers and follow guidelines and not get indiscriminate studies.
You think it's very appropriate for patients to say, what does this cost? And you know as well as I do that you and I don't know most of the time.
And if you don't, and I don't know, our colleagues who are far less insightful and not as motivated certainly will have no idea what these cost.
So let me ask the question again. Are we headed to socialized medicine? To me, the only difference between Obamacare and the present proposal is Obamacare, the federal government pays for it, and the federal government is broke. Under Trump's plan, the states are supposed to pay for it, and the states can't pay for it.
Right.
So really, what's going to happen? I really, do you know you don't know what's going to happen, but aren't you worried about it?
I thought he knew, and I was so excited to hear.
I mean, there's going to be a single payer.
Yeah, or some variety of that, and patients will somehow has to participate in writing that check for their care because the current model is unsustainable.
No question about it. And it's unfortunate. I mean, we had it, and part of it is, I mean, there's an explanation for this. Nobody had any idea we were going to live this long. And that's the major problem, isn't it? Because when Lyndon Baines Johnson, he passed Medicare, right? Got that legislation through. The average person in the United States was living to be 67 years old.
Yes.
Now Mayo lives average 78 and a female 80. Isn't that pretty close?
That's pretty close, but we also need to recognize the pandemic of Alzheimer's dementia. Mm-hmm. Someone is diagnosed with Alzheimer's disease every 71 seconds. So do the math, and our communities are not prepared for this Armageddon.
Now,
because we're living so long,
Absolutely.
Right? Yeah, sorry.
How do patients... how do you recommend that patients say to their doctors, what does this cost?
I think one would say to their providers, doctor, can you give me a ballpark figure as to what this will cost?
All right.
I think we owe them that responsibility.
Yeah, and I think that's a very reasonable question, and at least where we are, we send them down to the business office and they get an estimate.
Yes.
Yeah.
Yes.
Well, it's a tough problem.
Are you saying the rest of the country needs to be like Mayo Clinic?
Well, always.
It kind of sounds like that's what you just said.
High cost of health care in the United States. Mayo Clinic oncologist and palliative care specialist, Dr. Ed Creagan. Always great to have you on the program.
Likewise.
Thanks for coming.
Thank you.